Many people who have recovered from COVID-19 are still dealing with long-term complications from the virus. Their symptoms are wide-ranging, but one of the more common issues reported involves difficulties with sleep.
Sleep disorders are one of the commonest symptoms that nowadays our patients who suffer from acute infection are having these days. So, and mainly that what we are finding is that they complain of insomnia, fatigue, also brain fog. A lot of them complain about this, and also we see sometimes circadian rhythm disorders.
Dr. Cynthia Pena is a sleep specialist for Cleveland Clinic. She says circadian rhythm disorders occur when a person's internal clock is out of sync with their environment. As a result, they may suffer from insomnia, daytime sleepiness, difficulty waking up, depression, and stress in relationships. Dr. Pena says they don't know why some COVID long haulers are experiencing sleep-related issues. That is something researchers are still trying to understand. They also aren't sure how long those symptoms could persist for. However, the good news is that they are treatable.
This is just from my personal experience that those patients that were seen a year ago in our clinic, some of them that are already after 10, 12 months of treatment, I can see some of them are improving their sleep issues, but there is no exact data or the literature hasn't revealed for how long these symptoms are going to last.
Dr. Pena says those who are recovered from COVID-19 and are dealing with ongoing sleep issues should consult with their healthcare provider. Sleep plays an important role in a person's health. MD Network further investigated current guidance and available resources for COVID long haulers. The CDC prefers the umbrella term post-COVID conditions. This term better describes the broad spectrum of signs and symptoms that occur 4 or more weeks after acute COVID-19. Because the definition of post-COVID conditions may change as new data becomes available, the World Health Organization has developed a clinical case definition which states, post-COVID-19 condition occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually 3 months from the onset of COVID-19, with symptoms that last for at least 2 months and cannot be explained by an alternative diagnosis. Common symptoms include fatigue, shortness of breath, cognitive dysfunction, but also others and generally have an impact on everyday functioning. Symptoms may be new onset following initial recovery from an acute COVID-19 episode or persist from the initial illness. Symptoms may also fluctuate or relapse over time. In children, post-COVID conditions are increasingly recognized and a different definition may apply. Research shows that children may experience similar symptoms, including fatigue, headaches, and heart palpitations. The CDC has developed interim guidance and the World Health Organization provides good practice statements on caring for post-COVID patients. The UK's National Institute for Health and Care Excellence, or NICE, and the European Society for Clinical Microbiology and Infectious Disease developed guidelines for managing the long-term effects of COVID-19. Many healthcare organizations have adapted institutional protocols and implemented dedicated clinics for the management of post-COVID conditions. These clinics often perform comprehensive physical, cognitive, and psychological evaluations to provide individualized care. Multiple disciplines such as pulmonary infectious disease, rheumatology, neurology, or physical medicine and rehabilitation specialists, among others, collaborate as needed to address the often complex needs of post-COVID patients. If wait times are delayed in COVID-19 recovery clinics, healthcare providers may need to consider referring patients to appropriate specialists.